Well, thank you all for joining me today. What we're going to be talking about is health promotion and strategies for making the biggest impact. And so I just wanted to go over the agenda and then we'll jump into some introductions. So here are the learning objectives for today. We're going to talk about health equity, social determinants of health, how to engage the community, and then how to locate some resources specifically around evidence-based health promotion strategies. So just to give you guys a little idea how this is going to go, if we stay a small group, we won't actually do breakouts. We'll do it all together. But I'm going to do some presentation. Then you guys should have received or are receiving, Emily can tell us, a worksheet. Perfect, thumbs up, great. And my hope is that we will have some time for you to work on this individually and then to share with the group so that you walk away with a plan in place, a completed workbook, some action items, and we'll do some lessons learned. I also recognize that 4 hours is a very, very long time in the world of sitting at your computer. So we will have 3 10-minute breaks built in. But then in addition to that, like I said, we'll have some individual time. So you can also use that time as needed if you need to just get up and stretch while you're working on your workbook. So that was the agenda I have laid out. And then on the broader side of this, and my dog has decided to bark right now, sorry. The piece that is really about today is hearing from each other. So one of the pieces I've really found when I'm talking about health promotion and health promotion strategies is you just never, we're bringing in the community. We don't know what sometimes the results are going to be or who's going to be in our room or what they agree with or disagree with. And so I really would encourage you all to share your experience today, share what you've learned, share ideas you have, because I definitely, while I've had some successes and I've had some not successful initiatives, I want to be able to share both those pieces with you and hope you can share with me too. So my dog barked at the opportune time because you guys can see this is a picture of my dog here. Has nothing to do with this slide. I just try and make it my personal goal to work in a picture of my dog into every presentation because it adds a little enjoyment. So I wanted to start, since we will be spending a lot of time talking together, I wanted to start with doing introductions. I have no specific questions for you guys to answer, or specific things to say, but I just want to have all of us get a feel for, you know, who's here today, what are you hoping to get out of this presentation, and just kind of a little bit about yourself so we know where everyone's coming from in their learning today. So I'll go ahead and start. I'm Hillary Hansen. I work with the Montana Public Health Institute, which is a nonprofit organization supporting local and tribal health departments. I've only been in this position for about a year, and prior to that, I was in local health department. So my job right before this is I was the health officer in Flathead County. This topic is definitely near and dear to my heart. I started in health promotion. It's kind of where I grew up, and it's what I think one of the most essential pieces is that prevention component of public health and the engagement of the community. We really can't do this alone. So that's why I love the opportunity to be here and also just to share, like I said, my successes and my failures with you guys during this process. So I don't know if you guys just want to jump on and introduce yourselves. I can't, it's kind of hard with the presentation to see everybody here. So if you can just jump in and start, and Emily can maybe help me make sure we got everyone introduced.
For sure. Hi, this is Robin Suzer. I'm the Emergency Medical Services for Children Program Manager with DPHHS in Helena. And I'm always looking to learn more about health equity and health promotion.
Thanks, Robin.
Thank you. What about Erica?
Hi everyone, my name is Erica Ritzema. I use she, her, hers. I have a master's of social work and I have been working with Missoula County in the Community Justice Department, but my job is getting transitioned into the Missoula City County Health Department in just a couple of days. And so I'm taking this webinar as kind of a way to help transition how I think about my work more towards the health promotions and public health angle. Thanks.
Great, thanks, Erica.
What about Sandra?
Hey, I'm Sandra Gobel with Sanders County. I'm the tobacco prevention specialist, and I'm always trying to figure out ways to get the messages out in the community. And I also really have a challenging time lately with a few topics, and so I hope that we'll be able to address those today.
Thanks, Sandra. And make sure, and throughout, I mean, we want to add the informal piece of this too, of addressing any questions you have. So if you have specific things, make sure to bring them up for us to chat about.
All right. What about Joshua?
Hello, my name is Joshua Brown. I'm a University of Montana student. I graduated this spring in the Masters of Public Health program, and I'm also working on a PhD in anthropology. And my dissertation is focused on food systems within Salish indigenous communities and the related health outcomes. So I'm very interested in learning about health promotion as I move forward and thinking about constructing projects.
Great, congratulations, and thanks for being here.
What about Linda? Oh, we can hardly hear you, dear.
Oh, I think I have my laptop covered in stuff. Sorry. I'm Lewis in Clark County, and I'm a public health nurse. And here to learn more information about health promotion.
Oh, I'm only catching part of it. I hear public health nurse, and then we can't.
I heard Lewis and Clark County.
If it's easier, you can use the chat box too if your mic's being kind of funky. Let's see. We've got Randy. Randy, hi there. All right, Randy's in the chat. Do you want to do a little quick intro? Feel free to put it in there. And I don't think we've talked to Leanne yet.
Hi, I'm Leanne. I'm with the Dennis County Health Department. I'm the health promotion specialist.
Welcome.
Awesome. Oh, and Randy, yep, she's having trouble with audio. I'm the chronic disease specialist for Pondera County. Excellent. And again, Linda, feel free to use the chat. I'm sorry your mic was being a little funny. But thank you all for the intros. It's nice to see who we have today.
All right, thank you guys for being here and spending the time to do this. I know many of you are tired and COVID's been rough, and so thank you for all the work you've done on that and helping our communities and looking at ways to continue to move forward. So I'm gonna start this journey with my favorite part, which may not be everyone else's favorite part, and that I recognize, which is data. So I actually have a degree in mathematics. I know, don't hold it against me. I'm a total nerd like that. But I think this is a super important place to start, and one that we often miss in the health promotion component of this. I think a lot of times when we're out in the community, we hear about things going on, but it's a view somebody has, and without data, we don't really know where to start. Is this truly a problem? And who should be our target audience? Who is this really impacting in our community? So I first just wanted to really start by getting you guys in this mindset of data. So wanted to share a couple areas you can go to get data. First and foremost, many of you are probably familiar with the Epidemiology and Scientific Support Office at DPHHS. If you're not, you should be. They have lots of EPIs available to you. They show, they do specific reports on different topics. And this is actually, this screenshot I have is from last time I did this. So I'm sure there's even newer ones up there since then. And so I would recommend to you a couple of things. Number one, to always be checking this page. It's kind of my go back to, just to see, is there any new data out there that they've put together that I can look at? The second piece of it is they will do analysis for you on specific topics to your county if you request them. And so I would really push you guys to think about what data you need and know that there's folks in the EPI division that can assist with any of those pieces. The other component is IBIS. And I know the state is actually looking at replacing IBIS with something a little better, a little maybe easier to understand, but for right now you do have IBIS. So if you have never been to IBIS, basically it provides you the ability to select your community and look at some specific data for your community. So you can actually go in there and build specific reports on different topics they have data in. So I would highly recommend spending some time with IBIS, just seeing what's out there, seeing what you can get, and recognizing that that should be where you're starting any project, is determining what data is available out there. Some other pieces, probably pieces you guys all know about, but community health assessment. So for those of you who aren't familiar, local health departments and local hospitals a lot of times will create community health assessments, or community health need assessments is what the hospitals call them, China's. Any nonprofit hospital in a community is required to do a community health assessment every 3 years. So in an ideal world, it's done in conjunction with your public health department. But if you don't see anything from your health department, make sure to check with your hospital. It should all be posted on their website. They have to publicly post it. So that's always a good place to go. In many cases, they've collected not only the data that exists elsewhere, but in a lot of cases, they've also done additional analysis specific to the community, whether it's website surveys, phone calls, etc. And so it can oftentimes provide you some really specific data that you might not find anywhere else. There's, of course, lots of different data components available. I just named a few here. The county health rankings, if you haven't heard of them, come out every year and look at different metrics across Montana and basically how do we all compare to each other across Montana. These can be plus or minus. I've seen communities use these really well in a way of saying, we need to increase this. It can be hard to message sometimes if you're doing well in an area that you need to keep it a priority. So just know that the county health rankings come with a plus and minus, and be ready to communicate those appropriately to make sure people gain interest in them. And then CDC and the National Center for Health Statistics show lots of good data to communities too. Do you guys have any other data sources or things that you frequently use that you want to share with the group?
We use the Youth Risk Behavior Survey
Good one.
and the let me think what this is, Behavior Risk something, BRFS, I think it is.
Yeah, it's BRFS, Behavioral Risk Factor Survey. I'm with you. BRFSS.
Mm-hmm.
Yeah,
Mm-hmm.
Good one. And you get that from the state website?
Uh-huh.
Okay, perfect. Thanks. Other thoughts or ideas from anyone?
Randy has one in the chat. Are you able to see the chat or do you want me
I
to?
am not seeing the chat. It's not popping up for me.
Okay. Randy says, I am mostly here to learn about health equity and social determinants of health. I have some deliverables that coordinate with that, and I don't really know much about it.
Okay, perfect. We will be getting into that piece, Randy, as we go forward. So we'll talk a little bit about that component specifically. All right. So once you looked at the data, I think one of the most important pieces is really to look at who your target audience is then. This can be hard, particularly in small communities. When you look at the data, you can only get community level data. And so in a lot of cases, when we talk about this, you may be saying our whole target audience is the county. But the more you can narrow down who your target audience is on specific health issues, the better you'll be. So really trying to find that data and looking at multiple data sources. Can you determine location in your community, age in your community, any specific demographics that may help you think through who do we need to address related to this health topic? And that's just going to help you focus your resources and make sure you're moving the needle. So as I stated earlier, what I'm hoping to do today is that workbook that Emily emailed out to you guys is that you'll have some time to really think through your specific topics and what you want to do on them. So as you think through, you may already have an idea of what you want to talk about today. Like for Sandra, it may be tobacco, but you may want to narrow that down to, I want to work on some youth tobacco issues. For others, it could be COVID-19. It could be the pieces I know Erica mentioned, justice related to that. So even if it's not your full project, just for the scope of today, please choose kind of an area you want to focus in on, that you have the most questions in a topic area for us to discuss as we move forward. So we're going to, and I don't know, do we have enough people? We probably do, Emily, to break out into a couple breakouts.
Okay.
So what's going to happen first is I'm going to give you guys 15 minutes in a breakout. And what I want you to do first is spend, this is kind of the 7 minutes-ish, just to keep this around 15 minutes, is to just sit down and complete section 1 and 2, because I know you guys didn't get this in advance. So section 1 and 2 of the workbook, just the best you can, just really thinking through, what do I already know about the data that exists? And then what I'd like you guys to do is come together into your small breakout for that second part of that 15 minutes and just really share, what is the topic you're working on? We're going to build on this throughout the day. So this is your opportunity to introduce to your group, what's the topic you're working on? What data exists out there? And really hear from others, maybe other potential data sources or ideas they have on that topic. All right, thanks everyone. So we lost some folks, so we basically have a pretty small group. So we are not going to do breakouts moving forward. So I'm going to ask you guys to, I know it'll be a little bit of a repeat, but just hear from each of you tiny bit on the project you're working on, so that as we don't break out in the future, you've all kind of heard where everybody is at with things. So Erica, you're here on my screen, so do you mind kind of giving your overview first?
Sure. So my program is a sexual violence and intimate partner violence prevention program / healthy relationships promotion. We've been doing this type of work in Missoula for over a decade, but it's lived in more of the victim services world and not necessarily the public health world, and it's shifting more into the public health world. Most of my work has been with youth, although that's expanding to young adults too. So we do a lot of like education in middle and high school classrooms around this topic, and we utilize data sources like the YRBS quite a bit.
Thank you. Joshua.
Hello, my name is Joshua again. I am working, volunteering actually on a food sovereignty committee for the Confederated Salish and Kootenai Nation. And so we're looking at trying to improve access to local food, healthier local food. So we're going about this with two main approaches. One, we're focused on improving infrastructure of local food systems, and then also just improving people's consumption of local food. So that would be the promotion piece of it. As far as data, there's not much data. It's all kind of vague here or there kind of stuff spread out. And so I'll be collecting some of the first initial data to really try to tie health issues to food consumption practices of people.
Thank you. Sandra.
Okay, just a second here. Okay, so I mentioned to our group that I'm working on tobacco-free parks and trying to get one of our city councils to know enough information about the community and what it needs and wants. And I really have not done any digging into data. So this is really a great opportunity. Our group mentioned that I would obviously need to know, rather than just ballpark, the age groups that I've got demographic wise in our community. And then things about health, such as the cases of asthma, cardiovascular health, EMS reports on what sorts of cases they see, if it's a bunch of asthma or things, heart attacks. All of this will be really helpful to have. I've never actually looked at the community health improvement plan or our health department strategic plan either, and to see whether or not this sort of thing has been addressed, or a need has been brought up that we need to make sure and have parks that are tobacco free. So
Yeah. Great.
so unfortunately they mostly listen to me. Sorry.
No, that's great. Thank you for sharing. And it sounds like a good place for you to start.
Yep.
All right. Linda, were you able to get audio?
Can you hear me now?
Yes.
Oh, okay, great. Yeah, so we were trying to help Sandra with her project. So here in the health department, I am part of an inclusiveness program, group, and we are trying to get our employees more invested in inclusiveness, health promotion, and talking about health disparities. And we have collected data from our community through our community health assessment, and that's where we're at. We've only done one program together as all staff meeting. Yeah, so.
Thank you. Robin.
I have EMS data for the entire state, and you can break it down to different counties and cities as well. So I'm using that data because for adolescent health, mental health promotion, mental health issues and behavioral disorders are top 3 of why adolescents are being seen by EMS, and also in the ED. So I'm hoping to use this data and these reports that we have now to help increase mental health awareness for EMS and hospital personnel for adolescent health. And it also is for adult health too.
Very cool. Is that data available to local counties?
Yes, we have the 2020 data report has just been finished, and now it is on our webpage, the EMS and Trauma Systems webpage. So that information's out there. And we can also break it down in our office with our EPIs even, further.
Yeah, no, that is great. I think that's data a lot of people should want, even if they don't know they want it yet. That seems like super vital data. And in fact, links in so many ways to all these conversations we are having. I mean, it can link to the sexual violence that Erica's working on, it can link to tobacco that Sandra's working on. So that is really great to know that data is available. Thank you. Okay, I'm gonna go back to sharing my screen and see if I do this right. Okay, you guys, can you see the presentation again? Okay, so I had built in a poll, and so Emily can get it going, but just wanted to share everything I'm sharing here are my true stories. So I was asked to a meeting of community members to discuss school snacks. They wanted to start a program to provide healthy snacks for kids while in school and ask if we'd be willing to write a grant related to this topic. I said yes. What did I miss doing? All right. So, yeah, I mean, you guys definitely got the piece on the data, although I agree with B, C, and D could definitely be an answer too. We will talk about sustainability later in this presentation, so that's always a good thing to talk about too. But I think when I think of what happens a lot in our world, I think that this cartoon is super applicable to it. And I'm sure you guys could all share a time that you have got to a meeting and the very first thing people say is, I have a solution. And basically, we want you to find the problem that's going to let me do this solution. They obviously don't ask it quite like that, but you come into them saying, hey, we have this great project for you, without taking a step back and really looking at the data. And so this has definitely been a lesson learned for me. And that food one was really a great example of a time that I said, yes, I would be happy to write a grant. And as you guys know, when you write a grant, you got to put together all the data related to that grant. And when we really dove into the data, they were one of the wealthiest school districts in the community. They had, very few people on free and reduced lunches, etc. In my mind, really saying like, this is an important topic, but isn't an important topic to this district specifically, when in that county, there were other areas this would have been a better target to really move that needle. So it's hard to come back to data, but I think it's a super important piece to do. Any other thoughts on data specifically before we move to the next pieces?
Yeah, I'll say something quickly. As I mentioned, I am a PhD student, and I've been looking at data for specific communities, and I'm really shocked at how little there is out there. I thought there would be all this other additional information, and there's not for certain populations or about certain topics, and that was a bit of a surprise to me. So any suggestions on how to like collect this or data, maybe it's hidden somewhere and I just haven't found it yet, that would be great to hear from you guys.
Yeah, I mean, I can jump in with my suggestions, and then if anyone else has other ideas. Probably the number one thing I'd say to do first and foremost is to contact the EPIs at the state health department. I think there's a lot of data out there. I mean, even hearing Robin talk about the EMS data for youth, honestly, I've worked in mental health for years and I didn't know that data existed for counties to get. So I think contacting the state and really requesting that data. The other thing, Erica had brought up actually some of the stuff on the youth behavioral risk factor survey and some questions that are missing for it. So you can actually put in suggestions. This may not help you in the time frame you need, but just so everyone knows that you can actually put in formal suggestions for some of these statewide data collection things like BRFSS and request to have questions added. So I think if you really see something that's not just missing now, but missing for the long-term sustainability of projects or for the greater good, I would look at, are there any data sources where you could get questions added? Past that, I think what we're seeing communities really do in many ways is collect their own specific data, which can be hard, particularly if you need to jump into the institutional review board side of things in that data collection. But I think those community health assessments, needs assessments are allowing some of that data to be collected without IRB approval. So jumping into that, contacting your health departments or local hospitals and really seeing what data are they collecting, and is there a way to make that part of their routine data collection is an easier way sometimes to go about that. Does anyone else have any other thoughts on missing data pieces and places to start?
Would the WIC program have any data that might help with collection?
I didn't totally hear that. Did anyone else get that from Linda? Can you repeat it again, Linda? I have my microphone turned up.
Would WIC program have information that would help him?
Yeah, that is a good suggestion. I don't know if you heard that, Joshua. So the WIC program, SNAP would be another one in that nutrition specific area that they do collect a lot of WIC data. So that would be a good place to start. And the state health department would be able to tell you what data they collect from your community specifically. Great suggestion, Linda. Thank you.
Yeah, we could also ask other entities around who have applied for grant funding and ask them what sort of data they were finding and what they used in their grant applications.
Yeah, great suggestion. I can't tell you the number of times I worked in Flathead most recently, and I can't tell you the number of times that I'd see like a needs assessment advertised, and we had the community health assessment, and there was a housing needs assessment, and there was and when you really overlap them all, a lot of times there was similar things we were asking for, but there are tons of places people are collecting data. So if you have any agencies specific to that, check to see what data they have. Great suggestion. Anything else on this piece?